Today we're going to talk about 5 progressions in the phases of mechanical low back pain. The first is joint restriction. Then that turns into sprain and strain, and then it goes to degenerative joint disease. And the fourth is disc lesion, and the final phase, which is a no-no, is stenosis. Those are the 5 physical phases or progressions of mechanical low back pain.
Hey Dr. Ken, how can I prevent back strains?
That's a great question. I'm going to recommend 2 things. The best thing is going to be to do a hamstring stretch, because that's going to release a lot of the compensation pulling on your back. The second is to strengthen your core. And your core is not just your abs, it's also the sides and the back. And the best exercise for that is going to be to hold a plank, which most people don't like, but hey, it's going to work. So here's how you do it. And make sure to keep your neutral spine.
Okay, thanks Dr. Ken.
If you have pain when you wash your face in the morning, like this, then try this at home. What you want to do is spread your legs, push your hips out, engage the core, and then wash. That's going to be less stress on your back first thing in the morning. If you work on the computer a lot and your mid-back gets very tight, this is one quick stretch that you can do right at your desk. You bring your elbows in and push out. If you have mid-back tension and there's no results, did you know that the mid-back is more responsible for rotation? And that's how you get rid of that tension. So here's a great partner stretch that you can try out at home. What we're gonna do is we're gonna bring this left arm up, bring this arm, and we're gonna rotate her body. We're gonna pull with the arm, push with the opposite arm, just like that. And you're gonna notice a lot of relief in that mid-back section. So you can just push, pull, and this is gonna help to mobilize this mid-back joint to relieve a lot of your tension. Try it out. If you suffer with a hunchback and a lot of upper trap and cervical thoracic tension, what is that? That's the lower transition point of the neck to the upper back. So that joint getting stuck, causing a lot of that hunchback. Here's a quick stretch that you can do with a partner. You're gonna bring your partner's hands right behind their neck. You're gonna swoop your hand under and over and lock out this cervical thoracic region, which is where that hunchback is. You're gonna lift up and bring it down, and up and bring it down, and up. And that's gonna help to mobilize a lot of that tension that is stuck in that hunchback area. Try it out at home.
Hey Dr. Ken, how do I massage gun my own back?
If you have a massage gun and you live alone and you're trying to get that lower back area, the best way to hold the gun is hold it like this, grab it like this, and then you're gonna go on your back just like that. But the key to massage gunning any area is you wanna add movement. So if you're doing your lower back, again, hold like this, bring it back, and add lateral flexion as you massage your back. So if I flip around, it's gonna look like this. Try it out at home.
Thanks Dr. Ken. Hey Dr. Ken, my back is sore from running. Can you help me?
Yes, we can definitely help you with your back pain. The most important thing with running and back pain is engaging the core, and here's why. When you run, and let's say you arch your back a lot, then that constant pressure every step that you're running, that muscle is going to get fatigued and it's going to start to affect the joints and cause you pain. However, if you're activating your core while you run, and you can activate right here, you're squeezing your stomach and the core is on the side and the back, then there's going to be less fatigue on this lower back joint, making it easier for you to run for a longer distance with little to no back pain.
Okay, thanks Dr. Ken.
Today I'm going to be teaching you how to decompress your own lower back. Now for this we're going to need something sturdy like a kitchen table or countertop, and we're going to bring our hands about shoulder width apart. Now when we do this, we're going to face the countertop and we're going to bring our body up towards it as our arm supports our weight. Now our toes are going to just barely be touching to support just in case. Now when we do this, we're going to feel that pull on your lower back, and you're going to hold this for about 20 to 30 seconds. And you can do this 3 to 5 times per day. Now, when you do this, if you want to take this to the next level, you want to bring more weight on the lower half. And so we're going to do the same thing, shoulder width apart, put our weight on top of our hands. You're going to feel that pull on that lower back. We're going to lift our legs. Now, as a bonus, this is going to be a really good arm workout. 8 easy and effective stretches that you can do if you are working on a computer all day. This is going to be our second stretch that we're going to do to help to stretch out our mid back. So what we're going to do is bring both elbows onto the table, and then we're going to kind of slowly scoot our chair back just to get enough extension in our mid back, and try to really feel that stretch. Hold for 15 seconds, and then we're going to scoot back in. Eight easy and effective stretches that you can do if you are working on a computer all day. Let's move on to our 5th stretch, which is going to help to stretch out our lower back right here. This is an easy one. We're going to bring our hands to our side. We're going to follow the seam of our pants. We're going to go to the left, hold for 5 seconds, go over to the right, hold for 5 seconds. Then we're going to make a fist. We're going to lock out right where that dimple is, or that bony part is, and we're going to extend back, hold for 5 seconds, and then finally we're going to bend forward just like that and hold for 5 seconds.
Hey, Dr. Ken, is there any exercise that I should avoid if I have lower back pain?
If you have lower back pain, I'm not a huge fan of people doing crunches. And in general, I don't like crunches because it tends to put a lot of pressure on your lower back. So if you have lower back pain and you're trying to do a really good core exercise, the safest exercise for your lower back when you are experiencing lower back pain is going to be holding a plank. Planks have been known to be one of the safest exercises for your spine.
Okay, thanks, Dr. Ken.
Hi, my name is Dr. Ken, and today we're going to be going over a stepwise progression of 4 exercises. So we have to go in sequence from step 1, step 2, then step 3, and we only move forward when we're out of pain. In this video, I'm going to be teaching you the 4 progressions on how to get out of pain fast for your lower back, sciatica, disc herniation, or even a disc bulge. As a sports chiropractor and certified athletic trainer, I always see patients who ask, how can I get back to what I want to do as quickly and as safely as possible? So let's go over the do's and don'ts with exercise if you're suffering with lower back pain. The first thing you should do is start slow. What does slow mean? Maybe just start off by walking or doing gentle yoga stretches. What you don't want to do is rely on bed rest. Now, contrary to belief, rest is not always the best thing for your lower back.
Hey, Dr. Ken, how can sitting cause back pain?
Sitting, especially for a long period of time, can cause lower back pain, sometimes from this disc. So you can see my buddy James right here. He has his pelvis tucked, poor posture, kind of sitting forward like this. That increases that disc pressure, especially on the lower back, that can cause you lower back pain.
Okay, thanks, Dr. Ken.